Okay, I would like to welcome you to our workshop today, focusing on healthy skin, safe patients, and the value of patient hygiene. So let's start with introductions. My name is Katia Rodriguez. I'm a field product manager for antiseptics at Milnica Healthcare, and yeah, that's how it sounds. It's a very Swedish name. You see written around, and sometimes quite difficult to pronunciate, but hey. So basically, my role in the company is to impart some of my clinical experience. I'm a nurse by background. And use that clinical experience to support customers and my colleagues to educate them in a subject that I'm very passionate about, and I'm sure all of you are as well, which is infection prevention. So enough about me, because I'm boring. But I want to ask you to take this moment to put yourselves in your patient's shoes. Let's take you back to the hospital and imagine you're the ones on a hospital bed. Some of you might have been in that situation or had loved ones or have loved ones that are in that situation. And especially considering the past couple of years, we know that it can happen to any of us. And we also know that microorganisms are everywhere. We were painfully made aware that microorganisms are everywhere. So I want to start by you joining me in considering our odds. We know that roughly 5% or 1 in 20 patients entering a hospital will acquire an infection. And these are not just statistics that I'm pulling out of my hat. This is information actually from the European Center for Disease Control. And that represents 4 million patients infected in hospitals across Europe. That's a lot of people. But with numbers that large, sometimes it's quite difficult to grasp and to put into context. So I brought a little aid with me. Everyone familiar with Les Miserables from Victor Hugo? Yeah, classic. This book has 530,982 words. Trust me, I didn't count them. I used Google. It's very good. And imagine reading this book, and every single word on it represents an infection. You would have to read it 7.5 times to represent the number of infections in Europe alone. It's a big chunky book, right? But if Les Mis is a bit too old school for you, let's talk about Harry Potter. I know it's a bit of a controversial subject at the moment, but the entire series has roughly 1 million words, I should say. You would have to read the entire series 4 times and read every single word and count it as an infection to reach those numbers. It's quite impactful, right? But you might say, Katia, those are just words. We're talking about people. I couldn't agree more. So, and also, we're talking about European numbers. Let's talk about England. According to NICE, there are 300,000 HCAIs, or hospital or healthcare associated infections, yearly. So we're in lovely Birmingham. Birmingham has 863, if I remember correctly, inhabitants in its metropolitan area. That would mean that roughly 35% of the city would be infected. It does help put things into perspective, right? So, the general public, listening to these numbers, they might ask you, why aren't we doing more? Well, And we're here to tell them that infection prevention is hard. It is hard. There's a lot of work that goes into it. And everyone in this room knows that probably far better than I do. But it's difficult work. And we all know about the shortness of staff. We all lived through it as healthcare professionals. I remember when I was still in practice, it was an issue back then, 5 years ago. It still is. We don't have time to train staff. We don't have time to provide clinical education and training to new starters. Most of the times inductions are rushed, and that reduces institutional knowledge. We also see that the staff has low motivation because they feel overworked and underappreciated at times because there's no time to actually provide robust feedback. Also, there's the old chestnut of the fear of change. How many of you in the room, when you were trying to implement change into the practice in your hospitals, have been faced with someone within the team saying, well, what we've been doing works just fine. Why should we change? Can I get a raise of hands if this sounds familiar? Yeah? Yeah, I figured that would resonate with a lot of you. But we've identified all the problems. We know that they exist. So what can we do? Well, simple things do make a difference. Obviously part of an overarching approach, but simple things like washing with chlorhexidine gluconate, pre-surgery, post-surgery, and to provide that level of support to our patients. So you might be asking, why is she talking about chlorhexidine gluconate? Well, one, quite passionate about it. And two, I thought it would be a good idea to just give you a little bit of a refresher of what it is and what it does. So it can be described as a multitude of things. It's an antimicrobial, broad spectrum, so on and so forth. But simply put it, CHG kills most of the microorganisms that could potentially be harmful and cause healthcare-associated infection. So how does it work? I really like this slide. So the positively charged CHG molecule will be attracted to the negatively charged phospholipids in the cell wall of the microorganisms. Think of a magnet. So it's been pulled into the microorganisms. It attaches and binds to the cell wall, causing it to rupture. And because I like visuals, think of a pin to a balloon, right? Lysis of the cell happens, so all the contents of the cell are expelled, and subsequently the cell dies. No news here, right? So what makes chlorhexidine gluconate, or CHG, unique? It's the fact that not only does it have a strong affinity to bind with the microorganism cell wall, but also it has a lot of affinity with our own skin. So think again, magnet. As you can see in this picture, all the particles of iron are sitting on the surface of the magnet. And that's what CHG does to our skin. It creates a barrier of protection, not only killing the bacteria, but also has that lasting effect. So, what else? Well, on this slide, I particularly talk about the chlorhexidine 4% solution that we at Milnica provide, which I'm sure you're all familiar with, and you've seen the name pop up at the bottom if you were paying attention. So our solution has a pH between 5 and 6.5, which is very much compatible with the pH of our skin. So not only is it an effective antimicrobial, but also a gentle formulation on the skin. With me so far? Yeah? Great. So, you might be asking, yeah, this is all well and good, but how is this going to help our patients? So, with our patients or your patients, all of our patients, in the forefront of our minds, about a year ago, on 26th of April, 2022, Milnicke has put together a 2-hour advisory board composed of infection preventionists, leading infection preventionists working across the UK. Our aim was to ensure that we had a consensus, or we had an open discussion, a forum of discussion, in which we talked about patient hygiene as being a preventive tool against infections in hospitals. So these are our experts, lovely people. One of them who will be speaking tomorrow, Anna Thompson. She has a lovely session lined up tomorrow afternoon, I believe. But I'll start off with Todd Brindle. He's our medical director for antiseptics, gloves, and ORS at Milnicke. He authored this consensus document. And he also brought his expertise from the US. He's an acting clinician, so he does have very in-depth knowledge. Ruth Collins, who is the incoming president of the AFPP, who brought information from practice in theaters. Anna Thompson, who will be speaking tomorrow. She's a surgical site infection surveillance lead at Ashford and St. Peter's. Professor David Leeper, who is a well-known person in the space of infection prevention. He's an emeritus professor for clinical sciences. He was the chair at NICE when the SSI prevention guidelines were put together in 2008, amongst other things. Melissa Rochon, also a name well known within the infection prevention space in the UK, and I keep pressing this, sorry. She's the quality and safety lead for surveillance at the Royal Brompton and Harefield hospitals as part of Guy's and St. Thomas NHS Foundation Trust in London. Last but not least, Mark Lillistone, operational manager at Norfolk and Norwich, University Hospitals NHS Foundation Trust, who's also an infection preventionist, so bringing both of that into play. Now, because the first statement keeps popping up, and we'll be talking about 5 statements that these experts have agreed upon, have had consensus on. Let's start with the first one. Patient hygiene is more than a discretionary process. It is a fundamental element of basic care and must be seen as an essential, evidence-based infection prevention control protocol. So it's not just a commodity in patient's hygiene. It's a necessity. I would actually put it as treatment because it definitely is. It's therapeutical time that we spend with our patients, and I put myself in that group. As a nurse, I lost count of how many patients I've performed their hygiene on, given baths. And from that perspective, I know that the bath time when performing hygiene on a patient, it is a therapeutical moment. From a patient's perspective, it's a time in which they are made to feel a bit more comfortable. We're focusing on their well-being. They feel a sense of normality in an otherwise abnormal environment. And for healthcare professionals, I think it is a time for us to reassure the patient, to hear what they have to say. It's an important time to build on that relationship with the patient. And also, from a therapeutical standpoint, in terms of treatment, why does this keep moving? It's also it's an important time to assess the patient's skin. It's the best time to assess patient's skin. Check for any disruption on the skin barrier, any pressure areas, all of that, to actually plan for treatment. So you know that the patient has a wound, by doing the bath. What type of dressing are you going to use? So all of those things come into play. It is an important time. But as we were talking before, it comes with some limitations at this point. So we know that, and I'm not going to focus too much on COVID, I will say that, but we know that practice had to change as part of what we've been through collectively over the past years. Protocols had to be adapted, and sometimes hygiene practices were put in the background. So protocols weren't necessarily followed. Compliance rates tend to drop. So it is important to get back to normality. But also, focusing on what we were talking about before, all of those factors that contribute to infection prevention being hard. Staff doesn't necessarily have time to be trained. So they might not be aware of the protocols that are available in the hospitals. So it is important, and part of the discussion that these experts had, a big focus were on education and training of the staff, and to make sure that everyone knew the why behind the what. Everyone likes to know what they're doing and why they're doing it. So that's extremely important. Making sure that staff is retained, making sure that staff is happy, that morale has gone up, that leads to compliance, right? All in agreement so far? Yeah? Great. So the other thing that was highlighted as part of the initial statement out of this consensus was the need for new and more extensive data on the benefits of patient hygiene, in particular when using CHG. We do recognize that, and that's a necessity. So it's working towards that. But in order to get there, we also need to know what we're doing at the moment, benchmarking. So assessing and auditing our compliance rates is probably the best place to start, right? Okay, let's move on to slide 2, the statement 2, because the slides keep pulling me that way. All right, second statement. HCAI-associated pathogens on the patient's skin can pose a considerable risk to their healthy recovery before and after surgical procedures. So with this one, I think we all know that our skin is colonized heavily with microorganisms. And we know that for our patients, we know that to be true for our patients, and we know that to be true for us as healthcare professionals. So things as the simplest thing we can think of is washing our hands. How many times were we asked to wash our hands in public forums, in campaigns out of our government during COVID? Here I go again with the COVID. But we also know that post-COVID, compliance rates have kind of gone down. Who can blame every one of you? You've been asked to wash your hands time and time and time and time again. You know that you've experienced contact dermatitis because you've used so many alcohol rubs that your skin's gone raw. But it is important to keep compliance on basic standards of infection prevention. Healthcare professionals are vessels of transmission. We're the ones that actually go from patient to patient and care for them. And with us, we take microorganisms if we're not careful. So it is important to make sure that those pathogens on the skin are not being transmitted. And a good way to do it is through consistent patient hygiene and hand hygiene by the professionals. So using solutions with CHG that have high efficacy, that are gentle on the skin, will definitely make a difference. Think back to what I said before, small things do make a difference. All right? Statement 3, promotion of skin integrity carries importance in infection prevention and helps eliminate new portals of entry for pathogens. So with this one, I'm going to focus on healthcare professionals again. All of the safety drills that you see or safety precautions that you see when you're in airplanes or when you're going through a fire drill, what do they tell us? They tell us, make sure you're safe before you help somebody else. How many times in healthcare do we consider that as a priority? I pose a question to you all. Not that many times. Yeah, we're so focused on helping the patients that sometimes we forget to take care of ourselves. And if we're sick, we can't help anybody, right? And outside of work, we have families to look after, to support. We have our own needs. So it's important to make sure that skin integrity is at the top of your priority as well, because you're susceptible to infection as much as the patients, right? So making sure that both our patients and ourselves are taking care of our skin, making sure that you don't experience contact dermatitis, skin breakage, that your skin becomes more vulnerable to those microorganisms migrating to places where they're not supposed to be. I like to use the phrase or the comparison of between microorganisms habitating our skin and real estate. Seems like a weird one, but bear with me. So the important thing is location, location, location. That's the difference between healthy, benign colonization of microorganisms on our skin. They work to help us most of the times, and infection. They're going to places where they're not supposed to go. It's someone invading in your backyard or your house. We don't want that. So one of the ways you can do that is through robust protocols and comprehensive care bundles that include skin assessments, making sure that that is available not only for the patients, but also for the staff. All right? Everyone with me on that one? Yeah? Great. So, it did the job for me. A consistent approach to CHG bathing could be considered best practice for high-risk surgical procedures as part of an SSI preventive bundle to reduce the risk of infection. Yeah, it's a mouthful, but what we're basically trying to say is CHG, as part of a comprehensive bundle of infection prevention activities, is the way to go. It's not only one thing, not only one factor, one action that can change the numbers that we've seen before, the 300,000 patients yearly that acquire an infection in hospitals. It's the bundle approach. And it's important to state that bundle approaches tend to lead to more compliance. If we all know all the steps we need to take to make sure that patients are safe and that staff is safe, we're more willing to follow those steps. There's sort of a story behind it. You know which department, which person needs to do what. And it's also involving patients in their own care. We tend to, in healthcare, at times, I'm not saying all the time, but we tend to baby patients a little bit too much. And nowadays, patients are far more informed. They have information from all over, good and bad. We know that there's a lot of misinformation out there. So it's important to arm those patients with the knowledge that they need to make informed decisions, the right decisions for their own care. And the same goes for staff. That institutional knowledge needs to increase. We need to empower staff to make good decisions as well and to advise patients in the right way. And last but not least, consistent use of CHG bathing is effective in improving patient outcomes and provides added value to the NHS. Oh, let's not go into the video yet. So, we've been talking a lot about patient outcomes and how important it is to introduce CHG bathing as an effective tool in infection prevention bundles. But we also need to consider something that I like to call invest safe. Because the NHS is in a tough situation financially at the moment. We all know that. It's not just the problems with retention of staff and making sure that everyone is knowledgeable and receives prompt feedback, but we know that the NHS is struggling a little bit with money. And how can we save the money? So making sure that those infections go down, those readmission rates go down, that we eliminate as much as possible lengthy stays in hospital. And how do we do that? We do it by talking about prevention instead of treatment. And I know everyone in this room has been talking prevention for a long, long time. And hopefully these statements reflect what you're trying to do in your own departments, in your own hospitals, and that it pushes it a little bit further in terms of having those conversations, not only at MDT level, multidisciplinary team level, but also taking it to institutional level and bringing it back to the patient, making sure that everyone understands why we're doing the things we're doing. Yeah? And by doing so, let's save some NHS money that could potentially go elsewhere. Instead of focusing on the treatment, which is quite costly, let's focus on the prevention. Let's invest in prevention. Yep, everyone in agreement so far? Those statements sound good? Yeah, awesome. So, because I've been talking for a while, and you're probably tired of listening to me, I'm going to show you a short video that summarizes the 5 statements and talks about all of the actions that could be taken in infection prevention. Hope you enjoyed.
Pathogens are organisms that cause infections, entering the body through the mouth, eyes, nose, or wounds on the skin. In healthcare settings, these are known as healthcare-acquired infections, or HCA. Pathogens are organisms that cause infections, entering the body through the mouth, eyes, nose, or wounds on the skin. In healthcare settings, these are known as healthcare-acquired infections, or HCAIs, and often occur during surgery or whilst a wound is healing. HCAIs can lead to extended hospital stays, or in severe cases, may even lead to death. With an estimated 300,000 patients per year acquiring HCAIs in England, these infections lead to substantial pressures on the healthcare system. They cost the NHS an estimated £1 billion per year, with £56 million of this incurred after patients are discharged from hospital. Patients often require additional GP appointments or are readmitted to hospital if they have an infection. HCAIs are highly preventable, however, and there are a number of tools available to healthcare professionals and patients to ensure the risk of infection is minimized. Firstly, implementing risk assessments and surveillance exercises during a patient's hospital stay enables a high and consistent standard of hygiene to be maintained. Infection rates can also be reduced by educating patients and healthcare professionals about the importance of infection prevention, as well as making access to hygiene equipment easier. Bringing together a range of interventions is highly effective in minimizing patients' risk. This includes thorough cleaning, hand washing, and the use of chlorhexidine gluconate body washes. Chlorhexidine gluconate, or CHG, is a key ingredient within antimicrobial skin cleansers, offering effective protection against a wide range of microbes, including several strains of bacteria, yeast, fungi, and viruses. The integration of 4% CHG full-body bathing significantly helps lower the risk of HCAIs by using antiseptics to clean patients' skin. Treatments which contain 4% CHG are found to kill bacteria and help to cleanse pathogens from the skin. This means that CHG bathing captures susceptible bacteria such as MRSA and washes away those that are not affected by antiseptics, such as Clostridioides difficile organisms. Patients that have benefited from daily CHG bathing have reported fewer complications, greater ease of use, and are less likely to be readmitted to hospital. CHG is not absorbed into the skin, but binds to it to form a protective layer on the skin that kills bacteria. It is also a gentle treatment for the skin, being less likely to cause adverse skin conditions than traditional soap and water. Daily whole body washes which contain a CHG-based solution offer healthcare providers a highly effective measure to ensure that patients minimize their risk of infection, supporting them to recover from their surgery in a safe and healthy manner. If you are interested in learning more about how to reduce healthcare-associated infections and find out more about the benefits of chlorhexidine gluconate bathing, or would like to read our UK Clinical Consensus Statement on safe and effective patient hygiene practices, click the link provided or visit our website.
We need to be proactive and think about prevention as opposed to treatment, which is something we've been talking about over and over again throughout the presentation. And it's small things that do make a difference. And patient hygiene is one of them. So, again, prevention before treatment. And remember, patient hygiene is not a convenience, it's a necessity. It's treatment.